I'm sure everyone in the country and the world right now is aware of another emergency that's going on, and with the COVID-19 pandemic that's going on. And I know that Dr. Rietdyk and Dr. Colby are here in council tonight, so I wonder if we might probably get an update on some of the news that happened locally here today about COVID-19.
Thank you, Councillor Hall, for the question. I think I will just start and then let Dr. Colby answer any questions that Council has specifically from the medical side of COVID-19 and the impact that we will see across the country. So what I'm hearing from a lot today is what has changed. So a couple of days ago, we were all kind of moving along, tickety-boo. We knew it was out there. And we knew that across the world, people were dealing with COVID-19. I want to state right from the top that we have no cases of COVID-19 in Chatham-Kent. But what we are doing is we are putting in place, along with our provincial government to look at doing whatever we can to mitigate the impact that this virus will have in Ontario. So what has changed from Wednesday through to Thursday, and I don't have the numbers from Thursday to Friday, we had a significant increase in cases in Ontario. So again, not CK, Ontario. And we are starting to see countries of travel that we did not see before. So hence why the government has indicated that they would like Canadians to not travel outside of Canada. The government has also worked with our school boards and with public health to look at closing all of our schools for an additional 2 weeks after March break. And certainly it's a really good opportunity to get ahead of this. With students already being off, we certainly have that opportunity to say, let us keep everyone safe as best we can. Some of the impact that we are going to be working with as we navigate through March break is if families have gone away, when they return to Canada. So if they have left Canada, children that are 17 and under will have to be in quarantine in isolation for 14 days. Adults 17 and over, or 18 and over, need to self-monitor for 14 days. So these are some significant impacts that we are seeing. The government has also requested, and that is the province stepping up and saying, we're going to get ahead of this to stop all mass gatherings of 250 people or more. And that includes the people working at that gathering. So if you have 50 staff working at a gathering, you can only have 200 people attend. So we should be at 249 really. So in terms of numbers, so that gives you kind of an indication in terms of that. So I think it's important for us to get the messaging out that public health staff has been working for quite some time with our acute care partners in developing our pandemic plans, in getting ready. We are waiting for provincial approval to look at opening a separate assessment center. We hope to have that very quickly, and we will get that messaging out as soon as we can. So what we have done as a municipality, we have canceled all programs within our municipal facilities. So at the Capitol Theatre, at our museums, at our libraries, our Parks and Rec programs, and Dr. Colby has also asked, and I'll let him speak to some of his thoughts, that all youth and children and youth programs are canceled for the extent of this 3 weeks. And we will be reassessing after that 3-week time to then determine where we are in terms of how we're going to move forward. I would ask that council, if you are asked questions, to send those questions to us, and we will answer those the best we can. And so certainly we can do whatever we can to minimize the impact. I also want to thank council for doing social distancing. And I think that it's really important to note what we've done tonight is spread our councillors out. We've moved EMT out in terms of allowing that space to be between people. And that's really important in terms of decreasing decreasing transmission is, for any better way of looking at that. So we do have, and I didn't tell Dr. Colby I was putting this up here. So I do think this is a really important graph. And so while we've only indicated the number of mild cases in our Chatham-Kent Public Health Unit area, you know, and you've got a baseline, but I think if Dr. Colby would like to explain what happens to that curve if we begin doing school closures and remote work and social distancing and improved detection, and if we do detection and social distancing, you see that flat line happen. And so that's really why we are taking these measures right across the province to get ahead of the curve and to get a handle on this disease for the as minimum amount of impact that we can have provincially and specifically here for CK. So I don't know if you want to add some stuff to that.
Thank you, April, Your Worship, and members of council. Closing schools, closing children's programs, banning mass gatherings, this is not what we want in society. But what we want less is what happened in Italy. And if you don't know, there were a few cases that were noted, then there were a few more, and then there were a few deaths, and then all hell broke loose. And I'm not speaking colloquially. There were so many cases that their medical system was completely overwhelmed, and people died and are dying today without even getting to any kind of medical help. So when you see a situation like this, where you see a sharp peak and sudden incidence and geometrical rise in the number of cases, about 3% or so, depending on what country you look at, about 3% of cases require intensive care and respiratory support. And there are not enough respirators or beds in our community to handle something like that. And although the surveillance systems that we have are not finding in our area or elsewhere in Ontario that there is evidence now of community spread, it is the informed opinion of several very well-respected experts that just because we haven't found them yet doesn't mean that they're not there. And doing these kinds of interactions, measures to decrease the contagiousness among people in the community, they have to be done before this virus takes hold. They cannot be done, oh, things are getting bad, now we need to do something. It's already too late at that point. Nothing's going to happen and we'll be in an Italy situation. I will be damned if I let that happen to our community. And closing schools has very, very strong support in the literature for stopping transmission between students who are very efficiently pass viruses in a school situation or in a large playgroup situation such as recreational programs that we have. And that is the single most important measure. The time to do this is now. It is not later. And these are our internal modeling. This is customized by our epidemiologist, Laura Zettler, to project what could happen in Chatham-Kent. And you can see from looking from left to right that the effect of social distancing is extremely important to get this flattened. And even if we can't keep this virus out of our community, if we can keep it down to a dull roar so we don't see a large spike in cases, then maybe our health system will not be overwhelmed and we'll be able to support the people that need it most and lower the overall mortality level. So these are extraordinary times to live in, and this is an extraordinary situation. And I don't take any of these things lightly and appreciate all the support that you can give us at the Health Unit.
Anyone have questions? Councillor Pinsonneau.
Thank you, Worship. Through you to the good doctor here. I read an article today that they have isolated where this virus is, its origin, or they knew its origin, but they've, the university in Hamilton has narrowed it down. Does that mean now they can go about finding a vaccine or whatever it is to fix this?
Through you, Your Worship, the origin of the virus is mostly important from the standpoint of preventing things like this from happening again in the future. We have lots of samples of the virus that's circulating, and it's those samples that are important for designing vaccines and testing possible therapeutic drugs. So the short answer to your question is no. But this is still very important information. I haven't read that account that you're referring to, but the genetic code of this virus is incredibly close to a virus that is circulating in bats. So I don't know what they found, but it's so close that I don't believe that's a coincidence.
Okay, thank you.
Councillor Solomon.
I guess this is to April, or maybe it's to Dr. Colby. It's the what did you describe that again? I mean, I got in my head that the economy happens to operate between Canada and the United States with the biggest border crossing in North America that is simply a line that creates a border. Otherwise, I mean, we're the same as geographically as Windsor is the same geographically as Detroit is. Trucks come across every day. Are you telling me that every time a truck driver comes across, he or she has to sit by themselves for 14 days someplace? And if they do, tell me how it's being policed.
The recommendation for adults that are crossing the border after being in the United States is to monitor themselves for illness for 14 days. That doesn't mean you have to sit and do nothing, but if you do get sick, then you have to isolate and report that to the local health unit. These measures are, again, identification of cases and isolation are what has worked so far, because we haven't seen evidence of big spread or really anything more than local spread in Canada. I don't want to go too deep on this, but the World Health Organization differentiates between imported cases, locally acquired cases, and community spread. Imported cases, we all know what that is. Local spread means linked to an imported case. So we can trace the origin of it. When things get out of control and it's spreading in the community, there is no link that can be discovered to a foreign source. And our aim is to prevent that third level of community spread from taking hold here. Again, our colleagues in the academic world are warning that the time to put these measures in place is now. And you're seeing similar things that are happening in most of the provinces and territories across Canada.
Okay. So it doesn't sound to me like it's anything that a reasonable person wouldn't do without even being told. That if they knowing that there's a crisis, that if they started to have symptoms of maybe not even this flu, even if they had the one that probably kills 61,000 people in the United States last year, that they would, with the knowledge that this is going on, they would go to a hospital and find out if that's what they really have, and then it would be reported to the health unit.
Correct.
Yeah. So what causes me great concern is that the panic button that gets pushed on these things when people acting reasonably. Maybe that's the problem. Maybe people don't act reasonably, but it seems to me you've alleviated some of my concern. Acting reasonably, we're not going to slow down commerce crossing the border, the artificial border that between Canada and the United States. So good. Thank you for your information.
Councillor Oche?
Mayor Kenneth.
Sorry, go ahead.
Thank you, Mayor Kenneth. I also would like Council to know that we are putting in a number of systems in place where at all of our long-term care homes and all our retirement homes have moved as of yesterday. For most of them, we've finalized all of them to active screening. So before we just had signs up on the doors asking people, if you're sick, stay away. We have people manned at those doors who are stopping absolutely everyone coming in the buildings and asking them specific questions around their travel history, whether or not they feel ill. And if they do feel ill, we're sending them home. We're not letting them into our facilities. And if they have travel history, we're going through all the information with them as to what they need to do. When childcare centers open, we are anticipating doing the same thing at our childcare centers. There will be active screening so that families bringing children will be stopped at the door and asked very specific questions. So, we're trying to get the message out there. We've been doing lots of kind of poster messaging and passive screening at all of our municipal facilities. Those signs all went up this afternoon, and we'll keep being diligent with that. I think finally, to kind of close this off, unless we have some other questions, I do want to impress on Council that this changes every day. And so we might send something else tomorrow or the next day or the next day that is different than what we're sharing today. We, as well, are looking at our kind of messaging in terms of phone lines, and we'll be getting ready to man those phones so that we can answer people's questions.
Councillor Oche.
Thank you, Your Worship. I just want to confirm, in case anyone tuned in late, there are no mild cases. This here is worst case scenario if we were to get some. There is nothing right now in Chatham-Kent.
Please let me differentiate. We have no positive cases of COVID-19 in Chatham-Kent as of now.
Right.
Your characterization of mild cases versus severe cases, those graphs include all cases. And about 97%, there's not an acute threat to life, but in about 3% there is. And the risk groups for that are older people and people with underlying medical conditions.
Right.
So the ones that will stay well can stay at home. What will put pressure on our medical care systems are the ones that need respiratory support and acute care.
Right.
So, and maybe I misunderstood your question, but I
Yeah.
just wanted to clarify.
What I was worried about is somebody tuning in late, reading the top of this number of mild cases, seeking care in CPHU. Right now, we have none. So I don't want anyone reading this.
That is correct. These are
saying,
projection models for the
Right.
future.
And that's, I just wanted to make sure for anyone that tuned in
Thank
late.
you for clarifying that. I appreciate it.
Thank
We
you.
have no positive cases yet.
All right, thank you.
Sorry, Dr. Colby, just to clarify on that we have no confirmed cases, that doesn't necessarily mean there's no one in Chatham-Kent that is not carrying the virus. So I just want to differentiate that. Can you comment on that?
The term carrier is implies to me that someone can harbor the virus for long, long periods of time, appears to be healthy, and goes around spreading it. There is a phenomenon called a super spreader that isn't too far away from that definition. It is possible that we have undetected cases in Chatham-Kent. The symptoms of this virus are not specific. There's absolutely nothing that a diagnostician could say, well, that's definitely the real McCoy here. It's not that specific. So we have to differentiate between people with compatible symptoms and those that test positive. And this is the cold and flu season, trying to differentiate between people that have respiratory tract infections of a mundane nature, which everything appears at the beginning, and this is a daunting task, which is the reason why we're looking at setting up a specific assessment center.
Councillor Bondi?
Thanks, Mayor Cannon. Doctor, just to be clear, kind of expand on what Councillor Sullivan was saying. 18 years and older, if there's any international travel there, it's a self-monitor, but 17 and younger, it's suggested that there actually is a quarantine, a 14-day. So my boy, at 17, if he went to the States, is he to stay in his room for 14 days?
Yeah.
Because I hope he's listening, because he's...
Yeah, that's basically it. And the medical officer of health warrants he will get no bad comments about excess screen time under these circumstances. However...
A lot of my kids' friends are going to Florida. So when those kids come back, just so they're clear, because I had a little argument with my son on just prior to coming here. He said, oh, no. That's not the case. I said, I'm pretty sure that is.
That is the case. He will not be allowed to return to school even if the schools are open for 14 days after that. And
Okay, yeah, I think that's pretty
Important. Oh, sorry. There we go. Okay, great. Thanks.
Mr. Shropshire?
Thank you. I know we're going to be breaking momentarily. Just April's talked about how quickly this is changing. We will post regular updates to our website. So anybody that's listening tonight or viewing tonight's program, members of council, you can all get updates on a regular basis through our public health teams postings on our websites, and that's the best information. We're drawing that information from the medical officers of health at both our local level, our provincial level, and our federal level. So please check that out if you want an update on the best information. Thank you.
I just want to add, before we go into closed, this is going to impact all of us in one way, shape, or form over the next several weeks. And I'm confident we as a community are coming together. We have history of Chatham-Kent coming together for whatever cause it might be. Certainly, the municipality has been working very hard itself to get ready. We need the citizens now to step up, and there's some very simple things we talked about. I just want to reemphasize those. Washing your hands. It's a very simple thing, and social distance. So with those couple of things in itself, that will help that curve go down significantly. Very simple things we can do. And what Councillor Solomon mentioned, if you're not feeling well, don't go out. We don't know, you may don't go out to social settings and hang out with friends, because that could potentially transmit it. So it's those very simple things we're asking. And the other thing is we're asking people to be calm, that we don't want people getting hysterical collectively, as we pointed out. That's what we don't want to see. We're doing these measures to protect ourselves, to ensure we don't get into that situation like Italy is in. So it's a precautionary measure, but we need to take it very seriously. So I'd encourage everyone to listen to when public health puts something out, and I'm not asking to do it, please, for the sake of yourself, for the sake of your community, please listen to that.